Hi everyone, I am Dr.M.Subbiah. So today I am going to discuss about localization in neurology in lower limb muscles through case scenarios. So what's the first question to be answered in any patient with neurological disease? So where is the lesion? So what's the best way to localize a lesion? By taking history and physical examination. Now coming to the lower limb muscles, joints and nerves. So first I am going to give you an overview of the joints in the lower limbs. So hip joint. So the movements the hip joint are flexion, extension, abduction and adduction. So flexion is done by the iliopsoas muscle. Extension is done by the gluteus maximus muscle, which is supplied by the inferior gluteal nerve. So you can see the iliacus and psoas major muscle causes the flexion of the hip joint, which is supplied by the nerves from the lumbar plexus. And the extension of the hip joint is done by the gluteus maximus muscle, which is supplied by the inferior gluteal nerve. Abduction of the hip joint is done by the gluteus medius and minimus muscle, which is supplied by the superior gluteal nerve. Adduction of the hip joint is done by the muscles in the medial compartment of thigh. They are adductor muscles like adductor magnus, adductor longus and adductor brevis, which is supplied by the obturator nerve. So this is the obturator nerve. The knee joint. So knee joint, the movements at the knee joint are flexion and extension. The flexion is done by the hamstring groups of muscles in the back of thigh, which is supplied by the sciatic nerve, and extension is done by the quadriceps femoris muscle, which is supplied by the femoral nerve. So this is the posterior compartment of thigh. You can see the muscles of the hamstrings, semitendinosus and semimembranosus. The nerve supply is the sciatic nerve. So extension of the knee joint, quadriceps femoris muscle, nerve supply femoral nerve. So ankle joint movements are plantar flexion, dorsiflexion, inversion and eversion. So plantar flexion is done by the muscles in the posterior compartment of leg, medial, lateral gastrocnemius and soleus, which is supplied by the posterior tibial nerve. So this is the muscle groups in the posterior compartment of leg, which causes plantar flexion on the ankle joint. And dorsiflexion of the ankle joint is done by the muscles in the anterior compartment of the leg like tibialis anterior and extensor digitorum longus, which is supplied by the deep peroneal nerve, also known as deep fibular nerve. And the inversion at the ankle joint is done by the tibialis posterior muscle, nerve supply is tibial nerve, and the eversion at the ankle joint is done by peroneus longus and brevis muscle, which is supplied by the superficial peroneal nerve. So now coming to the case scenarios. A 16-year-old boy reports an inability to climb stairs and stand up from a sitting position. So what nerve is most likely compromised in this patient? The answer is inferior gluteal nerve. So the inferior gluteal nerve supplies the gluteus maximus muscle. So this muscle produces extension of the thigh at the hip joint, especially when the thigh is in a flexed position, rising from a sitting position or climbing stairs. An abnormal gait is seen in this patient after a car accident in which his left hip sinks when he lifts that foot to take a step, as shown in the right frame C of the given diagram. So which muscle group is affected in this patient? The answer is right gluteus medius muscle, and the nerve is superior gluteal nerve. So normally the gluteus medius and minimus muscles on the opposite side, that is the supported side, act to abduct their side of the pelvis against the lower limb, thus preventing sinking of the unsupported side. So superior gluteal nerve supplies the motor innervation to the gluteus medius, minimus and tensor fasciae lata muscles. Okay. So what muscle group is tested in this patient? So hamstring muscles. So the movement tested in this patient is flexion of the knee joint against resistance. The semitendinosus membranosus muscles contract. So this reflex confirms the integrity of what nerve? Tibial nerve, deep fibular nerve, superficial fibular nerve, obturator nerve and femoral nerve. So here the movement tested is knee extension. By doing knee jerk, extension of the knee joint occurs, which is done by the quadriceps muscle contraction. So the nerve tested in this patient is femoral nerve. So this reflex confirms the integrity of what nerve? So here ankle jerk is tested, which causes plantar flexion of the ankle joint. So plantar flexion of the ankle joint is done to the contractions of the gastrocnemius and soleus muscles. These muscles are innervated by the tibial nerve. So the answer is tibial nerve. So this is the posterior view of the tibial nerve. The tibial nerve is a terminal branch of the sciatic nerve that supplies the posterior muscles of the knee joint and leg. The tibial nerve is responsible for the plantar flexion of the foot at the ankle joint. The physician asks the patient to dorsiflex the ankle joint against resistance. So what nerve is tested? So dorsiflexion is done by the muscles in the anterior compartment of the leg, like tibialis anterior. So it is supplied by the deep peroneal nerve. It is also known as deep fibular nerve. So deep fibular nerve, deep peroneal nerve is a branch of the common peroneal nerve. So from the lateral side of the neck of the fibula, it divides into deep peroneal nerve and superficial peroneal nerve that supplies the lateral compartment of the leg. Deep peroneal nerve supplies the anterior compartment of the leg. So deep peroneal nerve is a terminal branch of the common fibular nerve that supplies the motor innervation to the four muscles of the anterior compartment of the leg. The four muscles are tibialis anterior, extensor digitorum longus, extensor hallucis longus and peroneus tertius. A child presented with high steppage gait after gluteal IM injection. What nerve was most likely damaged? This is a very simple question. The answer is sciatic nerve. The nerve supplies the muscles in the posterior compartment of the thigh and bifurcates into tibial nerve and common fibular nerves in the popliteal fossa. The common fibular nerve divides into the superficial and deep peroneal. So what nerve is tested in this patient? So the movement what the patient is doing, the plantar flexion at the ankle joint, which is done by the muscles in the posterior compartment of the leg, which is supplied by the tibial nerve. So the tibial nerve is responsible for plantar flexion of the foot at the ankle joint, which is being tested in this patient. Thank you.